Hey, good afternoon, folks. We're here on June 17th, 2022 for our Family Friday webinar series from Emory University. And today we're going to talk about transition of care, which of course is a very important topic for all of us. We're excited to have you all join us. We know some folks are still coming on, so bear with us as they do. I'm Bridget Guernsey Reardon. I'm in the Office of Parent and Family Programs, and I'm excited to do this in collaboration with our folks in New Student Programs. I do want to acknowledge Paula Zwillick, who's our colleague in New Student Programs, who makes all these things happen for us and helps us make this happen to get it recorded. As many of you know who've done these before, this is always recorded. It'll be posted on the New Student Programs website, on the Family Programs website, in a number of places. So we're excited to have you join us. I'm going to hand it over to my colleague, Sherry Oberens, in the college, and she will be giving you some instructions and we'll be able to introduce our colleagues. We have a very talented group of folks today, a lot of doctors in the house. So I'll give it over to Dr. Oberens.
Thank you, Bridget. And welcome back to all of our families and parents. Just as a reminder, if you've missed any of the information we've already presented, you can go back and rewatch our presentations. Take a little bit more time reviewing slides and websites if that's what you need as well. Everything is posted on our Emory Family website, and the quick link is listed below. A lot of the information that we're talking about today with transition of care, you've seen some of these faces before, you've heard some of these topics before, but we're really bringing it all together. And so today, as Bridget mentioned, lots of doctors in the house. We have Dr. Jane Yang, Dr. Sharon Rabinovitz, and Dr. Bobby Elliott, all talking about the transition of care. And what we mean by that is really helping your students have conversations with them now over the summer to get them ready to take care of themselves or in consult with you once they're here on campus. So you'll get to hear a little bit about all of their offices and their services. Adrienne Bryant Smith, who is in case management, is not with us today, but we will be sharing some of the information about her office as well. We have some great people monitoring the chat. So as you have questions, feel free to put them in the Q&A, and we will either answer them directly in chat or bring it live to our panelists as well. So
and Sherry, I want to mention that our colleague Bridget Mullaney Paxton, Dr. Paxton is also going to be looking at information, and she might chime in with some questions as Sherry and I do throughout this. So please get your questions ready. We're ready and excited to be able to help you get information that you need to prepare for transitioning your families to Emory. Yeah. So we're going to go ahead and have our panelists come off camera and introduce themselves, and then Sherry and I will go off camera, but we'll come back when we have questions for them. So let's go ahead and start with Jane, if you can introduce yourself.
Hi, everybody. I'm Jane Yang. My pronouns are she, her. I'm a licensed psychologist, and I am one of the interim co-executive directors at Counseling and Psychological Services. Nice to be here.
And then next is Sharon.
Hello, everyone. Good afternoon. I am Sharon Rabinovitz. I'm the Executive Director at Student Health.
And the next is Bobby.
Hi, good afternoon. I'm Bobby Elliott, and I'm the Director for Psychiatry Services at Student Health. Really happy to meet everyone today.
So we're going to give it over to our colleagues who will take you through the slides, and we look forward to giving you this information.
Well, first, I do want to welcome all of you who are new to Emory to this experience of transitioning your student to college. And for those of you who are first-time parents of college students, congratulations and welcome. As we approach today, we will be talking some about the services that each of our offices offers so that you have a sense of what's available to you and your students as you transition their care. And as you can imagine, based upon the representation in this space today, really when we think about your students, we're thinking about your students as whole people, and we're approaching their health and well-being from a holistic perspective. One of the most important resources to do this is actually a centralized website that offers well-being resources for students, and that's studentwellbeing.emory.edu, which we'll put in the chat. Your students can go to this website to access an array of resources that can support their health and well-being beyond the services that each of our departments offers. Yes, thank you. My particular unit is called Counseling and Psychological Services, CAPS. We do offer hours Monday through Friday, 8:30 to 5. We offer some extended evening hours for students who may be working jobs while they're in school, and for grad and professional students as well. Our staff are made up of licensed psychologists, licensed clinical social workers, and then training staff who are our pre-doctoral psychology interns and postgraduate fellows in psychology and social work. The university has contracted with a third-party vendor to provide extended services to students when they're out of state, overseas, and also 24/7 access to telehealth providers, and that's provided through Timely Care. And that option is called Timely Care Talk Now. Students can schedule non-urgent first-time appointments either online at counseling.emory.edu, or they can call us. We do know that students tend to prefer doing things online nowadays, which is why we offer the online option. Something to keep in mind is that even though students can schedule with us online, the scheduling window is typically during the day as well. Our scheduling system is tied to clinical paperwork, and because of that, we're not permitted to offer 24/7 access to signing up for those first-time appointments. In terms of services at our particular office, we do offer brief individual and couples counseling. If students come in as a couple, both individuals need to be students at the university. We offer group therapy. So we've offered a grief and loss support group, general sort of interpersonal relationship groups, men's specific groups, sexual and gender diversity. And we also offer international student support drop-in groups. We offer psychoeducational workshops on a number of different topics, including communication skills, coping with anxiety, procrastination. We offer skills groups that are more ongoing, and those in particular are stress management and biofeedback clinic, and then a group that we call coping with difficult thoughts and feelings. And that group in particular is to help students who may be struggling with having pretty persistent ups and downs, learning how to ride those waves and to navigate those feelings a little bit more. We offer both phone and walk-in crisis support. We do encourage people who need crisis support to come in between 8:30 and 3:30. One of the reasons that we encourage that sort of before 3:30 time is because when there are students who are in crisis, often that requires a collaboration with other units, because usually there's something that sort of leads up to that crisis. And it's a little bit easier to help students access those resources within the business day versus after hours, so that they don't have to sit with that overnight. We offer assistance with referrals to community providers, and then we also offer community outreach and interventions, so collaborations in different partnerships and programs across the university. I am seeing that there's a question in the chat about whether or not we take insurance. Students do not need insurance in order to access services at our office. And so all of the services that we offer are included in the mental health and wellness fee, as are other services in other units. And so students are able to access our services free of charge. I did mention previously as well that the university is contracted with Timely Care. One of the real benefits of Timely Care is, as I've mentioned, the 24/7 unlimited access and global access to providers. So if a student maybe is at home and they live out of state or they live internationally, they can access a Talk Now provider. Timely Care also offers scheduled counseling up to 12 visits per year, and students can download the app or access Timely Care on the web, and they can go ahead and sign up and then search providers to find a provider they think might be a good fit for them. If you could go back to the Timely Care slide, Dr. Rabinowitz is going to share a bit about the medical care and psychiatry right now.
Thank you, Jane. Just picking up where she left off, the university has really committed to making sure that access is available, especially started in 2020. So for medical care as well, students who are all over the country were able to access care if they needed it. They can call Timely Care and be connected with someone in their state and provide medical care via telehealth. They also have the opportunity to do the same for psychiatry visits. There is a site key that is needed to access, which can be accessed through, the site key is accessed through student health or psychiatry, CAPS. And so that allows people to access psychiatry visits as well through Timely Care. It is 24/7. And again, it's a package of all Talk Now, scheduled counseling, medical care, and psychiatry visits. Next slide, please. So a little bit more about student health. And it's a pleasure to be with you here today to help you with this transition and share all that our offices have to offer, and to also give you the tools, know where to look. It is kind of overwhelming. So we're very excited to be here to share all this information. Most importantly, Emory University has amazing quality healthcare, and we feel the same way that we want students to access that in student health. So physical care, mental health care is accessible, and there's a lot of different ways to access. You can see in the blue box, we're open Monday through Friday. We also have urgent care options on Saturday, so they don't have to go through the whole weekend not feeling well. We have you have access after hours to a call center where a student can be connected to a nurse to triage, and there's always a provider on call as well. Like I said, we have 24/7 Timely Care access, and there's also 24/7, 365 access to the student patient portal. And this is for non-urgent issues, but this is a very important way to access care, access progress notes, labs, billing, and the providers will always be available over during the business days to answer questions through the portal, the student patient portal. So it really is a very important thing of things to take away from today. The student patient portal is a very important access point for students. Next slide, please. Actually, go back one more slide. COVID care. A lot is going to be changing, and we're going to share that with you in a few minutes. But the student health website is going to be the main space for COVID updates, and in addition to Emory Forward. So look there and definitely look for more information as we get closer to the fall. One of the other really important things, and people go into student health for this exact reason, that we're working with students at a very important developmental time in their lives. And we are very passionate about empowering them and educating the students to be their own health advocate, and giving those tools to them. And so we're doing this webinar to make sure that we help you with that transition so that they can take the reins and move forward. But you're still there to help with the support. As you can see, this team of people presenting to you today work very collaboratively, and we want the care to be very integrated so that we have a huge network of support as your students arrive and are here through the 4 years. The picture here is our office. If you go north on campus and you hit the CDC, you've gone too far. But this is a picture of the office in case you come on campus and want to take a look. Next slide. So reiterating what Jane said, the visits, students can come every day and see a provider, and it's free. It doesn't matter which insurance you have, it's covered by tuition. It's where the labs, vaccines, medications, procedures, x-rays, and so forth, that's where the insurance piece comes in. Last week's information session on insurance dives deep into that. And also the website has a lot of information about insurance. If there's something that we need to answer, if we have time, we're happy to do that, of course. I am a family physician by training, so providing comprehensive full breadth primary care services is very important to me and our team. We have everything from sports medicine, nutrition, women's health, psychiatry, obviously travel medicine, which is coming back, allergy, immunizations, and so forth. So again, all this information is on our website. Next slide, please. So again, I just wanted to frame a little bit of information. There's a lot of work going on about what COVID care and provisions will look like going into the fall. So make sure that you're on the lookout for those communications, but they will be adjusted to be appropriate to what's happening in the world today and come August, as we know things can change pretty quickly. It's really going to be very much self-reporting, self-care driven, and self-access, meaning students will be accessing on their own through the portal. Students can access care through the portal routinely. That has not been opened up for COVID care, but that will be in the fall. So it's basically care driven. If students are doing well, mild symptoms, or asymptomatic, then they'll go through the self-automated process. If they are having symptoms, and this is the most important thing for us, if they're having symptoms, serious symptoms, or they're having challenges, we want them to be able to reach out to us, and they will have that avenue to do so. Isolation will also be changing. We have had isolation in place over the past semester, which has worked well. We want to make sure that people understand what that means. We also have accommodations available for people who are high risk, immunocompromised in any way, or for whatever reason need to be separated from their residence hall. So look for more. This is just a preview and to make sure that you're aware that things will be changing in the fall. Next slide, please. Deadlines. I'm always one of those people who just need to know the dates. So I want to highlight the dates that we have for deadlines. So immunization requirement date is July 1st, which is going to be coming pretty soon. So please upload the form that is provided into the student patient portal. It has to be signed by the provider. And so if you have any questions, you can always send a message within the portal by your student, or which is immunization compliance within the portal, or to immunizations-shs@emory.edu. Also, we have a little bit more time for the immunization waiver. I'm sorry, the insurance waiver. The deadline is September 1st, and that is accessed through their Opus account, and they would hit the health tile to do a waiver. Remember that insurance is an opt-out process. So if you do not waive or opt out, you'll be charged for the insurance. So that's another important Pearl takeaway for today. Next slide, please. I'm going to hand this to my colleague, Dr. Elliott, to talk more about psychiatry.
Thanks so much, Sharon. Yeah, so in terms of psychiatry, we're part of student health, and we provide psychiatric evaluation and also follow-up treatment with medication. Most of the counseling for students is provided through Jane's group, which is the CAPS, the Counseling and Psychological Services. We are physically located at 1525 Clifton Road within student health. We're on the first floor. Most of student health for primary care is on the second floor of the building. And to make an appointment with us, or if you just have a question, our number is listed there, 404-727-6145. During the pandemic, most of our appointments have been through telehealth, which we're able to offer to students while they're in Georgia. We have been increasing the number of in-person appointments available and expect to increase that more so in the fall semester as well. So those will also be available. In terms of accessibility, you don't need a referral to see us. And so the student can call us directly to make an appointment. They can be referred, so they can see one of the counselors at CAPS or one of the primary care providers, or be referred from an outside provider, but they don't need to do that. They can just call us directly. We want to make it easy. We want accessibility to be, really strong, so students don't have obstacles to reach us if they need us. Also, there are no provider charges during enrolled semesters, similar to primary care and also to CAPS. And so when a student sees one of our psychiatrists, there are no visit charges. If there are labs ordered, then insurance can be billed for that. But in terms of actual, doctor's fees, there's no fee for service. There's no charges during enrolled semesters. And also there's no limit on the number of sessions. There are some schools that do have limits on the number of psychiatry sessions at their student health, but we don't. We're fortunate to be able to offer as many sessions as the student needs. So we can see them for a brief time or a longer time if that's what is needed for the treatment. The services are private and confidential. And so, that's very important. Obviously, students need to know that, parents need to know that. Students can sign releases if they want to, and then we can share records or we can share information. But those releases need to be signed. Those can be done online through the student portal or in person or on a form that's faxed back and forth or scanned and emailed. Also, most of the urgent mental health services are going to be handled through CAPS and through student case management, which we're also going to talk a little bit more about. And so psychiatry is not handling most of the day-to-day kind of urgent crises, but we're more involved in the students who are on medication and getting them established, getting them started with medications if they need them, and following up with them as needed. Next slide.
Hi, everybody. So I am sharing this information on behalf of Adrian Bryant Smith, who's the Director of Student Case Management and Intervention Services. So case management provides support really from everyday assistance to crisis intervention. And so they often are a one-stop shop to support students who might be having academic concerns and need some advocacy or collaboration in connecting with their academic department to get some accommodation. They assist students who are struggling with unexpected or chronic financial hardship. If there's any sort of crisis involving basic daily needs. So for example, if a student has some sort of unexpected financial crisis and they might need some time limited support. If the student's experiencing an imminent danger to self or to others, or if there's a medical crisis. So oftentimes what will happen is individuals, including parents and families, will reach out to case management, and case management will coordinate a centralized care plan for the students who are involved. You could go to the next slide, please. Now, case management has two different arms, so to speak. The one side is the case management side, which is the crisis support and all the different things that I just listed. Parents and families can actually complete a student of concern referral form at the link that's provided on this page. Parents and families can also call the phone number under Student Intervention Services. So Student Intervention Services is the other arm of case management, and the acronym is SCIS. And so SCIS is used for more time-sensitive urgent need. So sometimes what may happen is a family may experience a loss or some other unexpected event that they anticipate will impact their student. And they can contact SCIS to share that information back to ensure that the sort of care net on our end is established, and that we can help coordinate a plan with the family to help support the student. You may advance to the next slide.
Before we move on, Jane, actually, there's just a few questions in the chat about the limit of CAPS, and maybe, again, similar to what you just said, student intervention services is really for kind of acute things that are popping up in the moment and checking on students, versus CAPS, which could be short-term, but potentially a little bit more long-term relationship. What are the limits to the CAPS sessions, and what happens if students hit that limit?
Yeah. So I think the one thing that I really want to emphasize is that CAPS operates using a social justice lens. And so what that means is when we're doing front-end assessment with students, we're not only taking into consideration their clinical need, but also the resources that they and their family have in order to meet those needs. So in general, most of the students that we meet with, we see for up to 8 sessions per academic year. However, we do have a subset of students that we have longer term relationships with. And again, that's based upon the clinical need of the student and the level of resource that student has. We will be talking a little bit later about circumstances in which a student's family may have financial resources available, and they already know that they want longer term care for their student. And we can talk through what would happen in those circumstances as well. But in general, that's sort of the parameter that we're using at this point in approaching our clinical care.
Thanks, Jane.
Alrighty, I'll take the next slide. So what can you do to prepare now, especially over the summer? These are very critical weeks to make sure that you have everything in place to make a smooth transition for you and your students. Next slide, please. So as a person who straddles both worlds, being the director of student health as well as being a parent, I have lived this and continue to learn. So I'll share some of the lessons learned, both professionally and personally. So it's really important to have the conversations, how to make a scheduled appointment, and let them do it themselves, but you are their backup. You just by being here, you're going to know a lot more, and you can direct them where they need to go, how to make an appointment. Just as an aside, appointments for student health are on a rolling basis. So if a student does not see an appointment at 6 o'clock at night, have them look again at 7 or 8. That's one of the big questions we usually get. The other thing is have them know about their insurance, make sure they have a picture of their card on their phone. Some of the terminology of copay, coinsurance, deductible, some of those main insurance 101 questions. If you have time to do that, I think that's really important. And it's a good life lesson moving forward. The other really important thing is, and this is something that we layer from the minute they get here, actually before they get here, but definitely when they get here as far as self-care and what that means and how that will lead to their success and academic improvement and just self-care, sleep, eating well, exercising, all those things are available to them. We support them in many, many ways, but hearing it from you and us, which, and again, over the 4 years that they're here, they'll be hearing that a lot. Like I said, insurance coverage, it is a huge adulting topic, but making sure that they know what their insurance company is, whether they're out of network in the Atlanta area, if they have out-of-state coverage for a Medicaid product, if that's something that they need to look at before they come here, and also reach out to the insurance team. If you have any questions, that's a really important question that we get often. If someone has an out-of-state Medicaid product, we want to know about that and answer your questions. Also compare, we have a lot of information on the website about insurance coverage. So having the time to sit there with your student and really dig into that for a few minutes, and making sure again that they have a copy of their insurance card on their phone. I'm going to hand the rest of the slide over to Jane.
Hi, everybody. So as I mentioned earlier, if your student is someone who's been in long-term therapy for a chronic condition, and they are someone who really anticipates they would prefer to have long-term support, you have a few different options in terms of identifying a long-term provider. First, you can always call my office and ask to speak with an on-call provider who can assist you with whatever particular circumstances that you may have. And you can sort of let them know things like that the style of provider that your student has typically most connected with, the actual clinical conditions that your student has been struggling with, and what you would really be looking for them in an ongoing provider. Another option that we have as well is that we have this website, emory.thrivingcampus.com, and these are providers that have been vetted by the university. You can go to this search engine and filter by provider, by insurance, by specialty, and by other provider factors. And so that would be another option that you can consider in this process. Certainly, if your student has any sort of chronic mental health or medical condition that has impacted their ability to complete school at some prior time, and if you have any sort of belief that there's a possibility that it could crop up again, then it would be worthwhile as well to consider whether or not you'd like to enroll for a tuition insurance. And that's something that the university offers. And I can put a link to the website in the chat in just a moment. And I will go ahead and turn it back over to one of my other colleagues for the next slide.
All right, thank you so much, Jane. I think this is another slide that has to do with transition of care, and a lot of this information has already been covered by Sharon and Jane. I'll just kind of run through it and we'll see if there's any additional questions that come up along the way. So as we've been saying, in terms of preparing for a transition of care, coordination of care is one of the keys. As Jane was just mentioning, if the student is already in care, whether it's medical or mental health care, really preparing for a transition, a piece of that is coordination of care. And so having a discussion with the current care provider about, what's going on in terms of the condition, but also what kinds of future treatments would they recommend, and what kinds of providers do they recommend in the future. And in terms of prescriptions, this next kind of bullet point, you obviously want to ensure that the student has enough medication. So hopefully they have at least a month of medication when they're coming to campus that they're bringing with them. And a piece of that is that to get a refill on medication, we would need to actually see the student first to be able to provide that refill. And so they would have to have an appointment first. And so it's always a good idea just to give them a few weeks lead time, in terms of having a refill on hand already. So they're not kind of scrambling to get a refill if they're running out. Sometimes there will be a letter from the provider, or there may be records that are transferred. Again, it depends on the complexity of the condition, but that can be helpful. And certainly we can add any medical records to the student's chart at Student Health, or CAPS will at CAPS, if that's received in the office. And we'll also ask for releases to send for records if that's going to be helpful if they come into our care. So here's information in terms of diagnosis, medication, emergency plans. These are all things to review with your provider, the current provider, but also with the student. And then in terms of ADHD, we always get a few questions about ADHD. So there's a lot of really good information on our website about ADHD. So I definitely would first advise you to go to the website. You can go, there's a tile about our services, another tile about psychiatry, and then under there about ADHD. And within there's a lot of information about what we do and also what the local community providers do. The short answer is that we do treat ADHD in the psychiatry clinic at Student Health, but only if it's comorbid with something else we would be treating, typically depression or anxiety that we're prescribing for. So if a student if the only mental health medication they're taking is ADHD, then we will help them establish with a provider in the community. And there are several psychiatrists who do a great job treating students for ADHD and work with us very closely and accept the student health insurance. So anyway, there's again a lot more information on the website. And there also are educational plans and accommodations through the Department of Accessibility Services that you may need to look at in terms of ADHD or other types of academic accommodations. And there's a lot of good information on their website as well. So I would certainly advise people to take a look at that if you think that your student is going to need accommodations for ADHD or for anything else.
And Bobby, that's a great note that next week we actually have Allison Butler, who's our director of the Department of Accessibility Services, who will talk about accommodations for chronic, medical, mental health, other things, ADHD as well, learning challenges. And so if that is one of your students who already has that documentation, you'll definitely want to chime in next week.
So we know that we shared a lot of information with you all today. An easily accessible place for you all to find this information is at this link on this on this slide. We really want to also emphasize at this point that while we represent different units and areas on the campus, we work very collaboratively with each other. And so if your student shows up on any of our doorsteps and we assess and determine that they need care in other places, we will do our best to help them make those connections. Again, we want to thank you all for being here today, and thank you for entrusting us with the care of your students.
And Jane, I want to add too, we work with a lot of people who are very humble, and that includes you and the folks that are on this call. And so we want our families to know we have accredited services here. We have such highly credentialed professionals, and they work with all of us, not just within healthcare, but they work with Sherry's office, they work with me, and of course they afford students confidentiality. So they can't tell us things that they can't tell us. However, we do have a really good holistic approach, and I want families to know that. And it's just such an important part of your students' adulting to try to help manage this, to try to figure this out. But of course, we know you're going to help them along the way.
And actually, this is a good chance. There was a few questions in the chat, and I love the term adulting. This is a perfect adulting question about where the closest pharmacies are around campus. And so we are lucky that Emory has 2 CVSs on either side of campus, one in the Emory Village and one at Emory Point. But Sharon, did you want to add anything to that, and how quickly, or Bobby, Sharon and or Bobby, students should be able to transfer their prescriptions to a pharmacy close by?
Absolutely. It's relatively easy to transition between CVS all over the country. If someone needs a specific change, or they're in the process of titrating or changing medication, then I would recommend that they actually see somebody at Student Health. And if someone is being seen for chronic illness, I think it is always a good practice to make an introductory appointment with Student Health to make sure that we have your information in our system. We can be there for any urgent. It's always better to see somebody not in urgent crisis, but develop the care when in a relaxed fashion. And then we can obviously be there no matter what in an urgent space for students. But yes, transition of medications, prescriptions, very easy through CVS. But if it's an ongoing adjustment, I would have the student make an appointment with us or psychiatry.
Great. And then just one more clarification about session limits. This does seem to be coming up again. So Jane, if you could share again, and to Sharon, student health visits are unlimited. Students can always go to student health services. Visits are free, no matter the insurance, no matter what you are. So going to student health, if it's sore throat, a cough, a scrape, all of those things. But for counseling and psychological services, Jane, if you could just clarify that one more time.
Yeah. So as I shared previously, our general guideline is up to 8 sessions per academic year for individual therapy services. Now, certainly, if as we're approaching those 8 sessions, we'll be assessing with the student what their ongoing needs are. And if there's an indication that the student needs longer term care, the provider will speak directly with the student about what those options might be. Now, we also have occasions where students are done in 8 sessions or less, or they meet for 8 sessions and they say, I'm going to take a break for therapy, and then something may crop up later in the same year. Those students can always reach back out to us, and we can reassess their needs and what the circumstances are. So I think it's really important to keep in mind that when we talk about the up to 8 session limits, that's a parameter, but it is really not like we're slamming the door in the student's face and they can never come back. So I really want to reassure all of you about that. I think what's really challenging is in the past, we didn't advertise what our parameters were, and then students would come to our office with an expectation that they could come in for long-term care. And it really left a lot of students and families feeling disappointed that wasn't transparently communicated up front. And so that's part of the reason why we share what some of our parameters are and what our general guidelines are. But again, we're going to be making the best clinical recommendations we can that are dependent upon each student's circumstances, including the level of resource available to them.
And Jane, it just made me think, and we've all worked with students for such a long time, parents and families often get those panicked phone calls from students, right? In crisis, in the moment, in the middle of the night, saying nobody's available or I don't know where to go. And I think maybe just one more round of how to support your students, especially during this transition when it's new, is we do have a lot of services available. it might not be in the very instantaneous second that the student is calling you at 3 o'clock in the morning. But that shouldn't make students not want to reach out, right? Like we really want to encourage that students are reaching out, even if they think they've hit a limit or they think that something's not available. Sharon also mentioned that sometimes appointments for the next day or the emergency appointments will pop up in the next hour. And so very little is final and absolute. And sometimes students maybe think that that's the case, or they've interpreted it that way. And so as parents and family members, just reminding them that there is a lot of help and it never hurts to ask, right? Just following up and sending an email or clarifying again. And so if students do have a crisis at 3 a.m., I should just mentioned, maybe that's a good thing to end with before we go off for the weekend. Jane, any other last minute recommendations if there really truly is a crisis in the middle of the night?
Yeah, so if there's truly a crisis in the middle of the night, especially for undergraduate students, most of your students will be living on campus next year. And oftentimes their easiest point of contact is going to be their resident advisor, who is a person that they will be seeing probably every day because they live together and have more familiarity with. And so they can start there. And then that resident advisor can basically work with them to identify what the resources are in the moment. And then if the resident advisor needs to enlist additional care, then they will do that. Let's say you get the call at 3 a.m. and your student is really freaked out. Then at that point, your student or you can call SCMIS, which is the Student Intervention Services team. And that person can triage your student to see what the immediate need is and whether or not there's something that needs to happen in the moment, or if it's something that can wait a few hours in the morning and your student just needs a little help calming down. If what you know as a parent is that, oh, well, my student doesn't need a thing, they just need someone to talk to, then at 3 in the morning, they can access Timely Care. Now, what I will say is that the Timely Care app requires that your student registers using their Emory email address. It does require that your student answers a few questions prior to being able to access the service. So I would say as soon as your student has their Emory email address, as soon as they're here, go ahead and have them download the app and get set up so that when it's 3 in the morning, they can just log into the app and not have to go through all the steps. It'll all be set up and ready to go for them.
That's awesome. Thank you.
And I do want to add one thing, Sherry, in that Jane and the CAPS area have so many clinics for students, whether that's support groups or whether that's discussion groups. And I've heard from families about how their student benefited from the procrastination prevention group. And Jane does a great job of getting that to us. We put it on the portal. So families, you will have access to that information through the family portal. If you go on the portal now, you'll see what's being offered even now in the summer. And so there's so many opportunities to have access to the counseling center experts without necessarily needing to go to a counseling center appointment. You get to talk to other students, get to process what's on your mind, whether it's the stress clinic or the other clinics I've mentioned. So I really want to applaud our folks in health services and counseling for all that they offer.
And that is the end of our official panel for today. Thank you all so much for your great questions. A big thank you to all of our amazing panelists and experts in our health and well-being. Reminder, next Friday is accessibility services. So again, that's getting those accommodations for students anybody who's had accommodations for any reason in high school, please, please, please attend this. It's good to get your students registered, although they can register throughout their time at Emory. And then we'll be some other things coming up, advising and registration, and then housing, dining, and res life. As a reminder, all of our webinars are posted online. So college.emory.edu/orientation, where you can find these slides and other recordings as well. On that note, on behalf of Bridget, we'd like to say happy Friday. We hope you have a meaningful Juneteenth celebration on Sunday and or Monday, and we will see you next week.
Thank you all.